So this model from the University of Washington is projecting absolutely dire circumstances in Florida. And they assume Florida has a better policy response to this than they have. I mean, this is worth understanding about Florida. It's worth understanding in general. The projections are terrible in terms of the numbers of American deaths that we are going to see. The U.S. has the worst epidemic in the world and one of the worst managed. Ultimately, the pace at which U.S. hospital capacity is going to be overrun is daunting and terrible. Right? When U.S. hospital capacity is overrun, what that will mean is that severely ill patients who need to be in a hospital to try to keep themselves alive, they will not have hospital beds to hold them. The projections are just terrible. In the case of this widely cited model from the University of Washington, the model is also built on the assumption that we Americans live in a country where we're all going to be subject to stay-at-home measures, and we're all going to be subject to the closure of non-essential businesses to slow the virus's spread. Well, the U.S. federal government is not making that happen across the country. And so lots of governors aren't doing that. What happens to the parts of the country where that mitigation isn't happening? What happens to all of us if big swaths of the country won't do it or won't do it until it is too late? Well, joining us now, I'm honored to say, is Dr. Christopher Murray. He is the director of the University of Washington's Institute for Health Metrics and Evaluation, IHME. When you talk about these sort of dramatic peaks, the sort of apex numbers that your model suggests, that the virus could ultimately be killing over 2,200 Americans a day, you've got very dramatic figures for individual states. Can you tell us how much of a difference there is between those apex numbers in the context of mitigation and those apex numbers in places where they don't do it? There are states where there really aren't any statewide measures in place right now. And I know your model assumes that they'll get it together and they'll do that. But how big of a delta is there between those two different scenarios of states that aren't doing anything versus what they could do if they were following the sort of regimes that are designed to slow the virus?
Well, I think the way to think about that is that every day that you have unchecked transmission in the community, you're going to get a percentage increase, 10, 15%, depending on the state. And so every day you wait, you can multiply those numbers out. And so an extra week really adds quite a lot to how many extra people eventually are going to die, how many extra people are going to have severe disease, and the load on the whole health system. So every day counts because of that exponential growth that occurs through transmission, unchecked transmission in the community.